The causes of sudden blurring of vision usually are due to something at the back of the eye, something like a retinal detachment or bleeding in front of the retina, such as vitreous hemorrhage we call it. So these are two conditions which cause painless blurring of vision or sudden loss of vision. As against painful sudden loss of vision usually happens in another serious condition called as acute angle closure glaucoma.
You should get your eyes checked every yearly, more so if you are a diabetic or as advised by your physician. Children should get their eyes checked at least at 3 years of age if they have not had an eye checkup since birth. Thereafter, every yearly an eye checkup is recommended even for children.
The causes of itching usually indicates some form of an allergy, or maybe it can happen also because of the pollution. So if you have very itchy eyes, make sure you avoid the temptation to rub the eyes and visit an ophthalmologist to maybe take care of it. Nowadays, most of us are glued to the screens, either computer screens or the phone screens. And what happens is that when we are constantly looking at a screen, we forget to blink. So because of the reduced blink rate, what we call it as evaporative dry eye. What happens is that the tear film which otherwise coats the front layer of the eye starts evaporating, and therefore we get the sensation as if the eyes have gone dry. There is maybe some kind of an eye strain that you experience, and that's usually due to this evaporative dry eye. That's how the screen is harmful to your eyes.
Contact lenses are not recommended if you have dry eye, mostly firstly because your eyes themselves will not tolerate them. There will be intense foreign body sensation, watering, irritation when you wear contact lenses when you have dry eye. It is recommended that you get your dry eyes treated completely before opting for contact lenses, because it's a foreign body which you are placing in your eye, and if your cornea is not up to it, you will definitely have problems. Contact lenses are considered to be very safe alternative to glasses, provided you follow a set of rules before you start wearing them. Do not overwear contact lenses beyond 8 hours. There should at least be one off day. Just like we take a break from work each week, you should give one off day in the week for contact lenses. Hydrate or lubricate your eyes as frequently as possible. And if you have any problems experienced while wearing the contact lenses, like grittiness in the eye, burning sensation, intolerance to contact lenses, then do not wear the contact lenses. If worn properly, there are several patients who are using contact lenses for several years in their lives.
In a typical eye exam, obviously it's a very painless procedure. Obviously, we first check the vision of the patient, check the intraocular pressure of the eye. We check the front part of the eye using a machine like this called as the slit lamp. And then we also sometimes put drops to dilate the pupils so that we can have an extensive view of the back of the eye. That completes the eye examination, and this is again followed by or preceded by eye movements and extraocular areas of the eye, which are carefully examined by the ophthalmologist.
Diabetes can affect each and every part of your body, and eyes are not spared. Starting from a simple problem like having frequent dry eye or frequent stye, chalazion, you can also have a development of early cataract, development of diabetic retinopathy related complications which can lead to loss of sight, muscular palsies where you paralysis where you develop double vision when you are seeing in front. So all these problems are largely preventable if you keep a good control over your sugar, visit the physician regularly, and have an yearly eye checkup. Most of them can be prevented. If your blood pressure is well controlled, at least an yearly eye checkup is recommended. But if there have been spikes in your blood pressure, then your physician will recommend an eye exam whenever they detect that the levels of blood pressure have gone really high. It is, however, recommended that anybody with even well-controlled hypertension should get their eyes checked every year. The drops which are prescribed for curing or treating dry eye are called lubricating eye drops. Usually they are considered to be very safe. However, all drops have preservatives in them. So some people can be allergic to these preservatives if the drops are not maintained properly, if the bottle cap is not, if the bottle is not recapped properly. There are chances of contamination which can lead to development of conjunctivitis in the user. So if you're careful in using the eye drops, like washing your hands frequently, recapping the bottle properly, and not extending beyond the set date of manufacture, you can definitely use eye drops, the lubricating eye drops, for a long time. Myopia means having minus power glasses. People with myopia are short-sighted and they are not able to focus clearly or able to see clearly objects that are at a distance. So, for example, children will require glasses to see the blackboard clearly. That is called as myopia. And hypermetropia is exactly the opposite. People are far-sighted. These children or people are able to view far off things quite easily, but whenever they have to read anything or look at the tablet or the phone, there can be problems of eye strain or blurry images. This is called as hypermetropia, and these people will usually require plus glasses in their spectacles.